Hi, I'm Tracy Bonebrake Miller. Thank you for taking the time during this busy time of year to take a look at my presentation. I'm investigating the best instructional methods to increase comfort level of quality CPR skill performance. I'm primarily focusing on lay people as opposed to healthcare professionals. However, in my literature review, I am taking a look at um, some studies that have been done with professionals in the area of healthcare, just as it relates to increasing comfort level and how effective those methods are. I've decided not to do. I enjoy, as I'm watching some of your presentations, I enjoy actually seeing the in-screen picture of you recording your narration. However, it does cover up some of the things in my presentation, so I was playing with that. So I hope it's okay that I just decided to do the narration. Educators are interested in increasing the rates of bystander CPR. So different techniques have been studied. So some of the main techniques that you all might be familiar with, and I know some of you in our class are also CPR instructors such as myself. So you might be familiar with an all in class setting where CPR skills are taught. You might be more familiar with the blended learning where some skills are learned online and then participants are tested in a lab setting with feedback mannequins. And now more popular for the medical professionals would be a sim lab. So this study that was done um, contained sort of a blended method where there were some instructional videos and mannequins were distributed to students ages 12 to 14 in 806 schools. So you can imagine that it was a pretty expensive undertaking, but it also wasn't the same high level mannequins, feedback mannequins that you may have experienced in some of the classes that you have taken or some of the classes that you may teach. So students watched the video and then they actually taught somebody else. So it was that instructional method of learning and then reteaching. But in the months that followed, CPR rates did not increase, unfortunately. This particular study dealt with healthcare providers, but the part that was important to me was taking a look at the quality of compression. So not only the quality and depth, but also the compression fraction rate. So that's the amount of time spent during the entire resuscitation attempt actually performing compressions. So this compared just-in-time training. That's the name of a company that utilizes the training that all of you are probably familiar with the American Heart Association, the American Red Cross, or Health and Safety Institute. And it took a look at whether or not if a healthcare provider could just come in and teach others about compression and compression fraction rate, it wasn't as effective as when the just-in-time training was utilized. So having that immediate feedback, using the feedback mannequins, using those feedback devices, and when we're talking about healthcare providers, are doing BLS and above, so not just the layperson level, which is named Heart Saver by the American Heart Association. Some of you might be more familiar with that. So this is using BLS and above where the compression fraction rate is actually timed and the instructor uses a stopwatch. So that part is the part that wasn't the high quality. So basically using those curriculums, those curricula as a standard is really important and showed to be beneficial as opposed to that healthcare provider coming in and just lecturing and trying to teach it without that curriculum. So in this study, we're really changing gears because now we're heading back to talking about lay people. And this took a look at individuals between the ages of 40 to 70 years of age who might be more likely to witness a cardiac arrest. And those folks have also been found that that subsegment of the population has been found to be underrepresented in CPR classes. So VSI is video self-instruction. So it's kind of interesting. So we go from this last study of talking about the importance of being in class and having feedback mechanisms, etc. But of course, that was for healthcare providers. And now we're taking a look at someone who's literally just watching a video and just hearing that story, hearing the steps, and then being expected to perform. And it seems like there were some positive outcomes. I'm reminded of a story that I read a number of years ago where a young person, it was a young teenager who hadn't had formal CPR instruction, but literally watched the episode of The Office and ended up performing CPR, and ended up, the person survived for advanced treatment. So that was just, I think, 5 or 6 years ago. I remember sharing the news segment with my students. So it's interesting. It's better to be educated than not at all. But the thing that makes me really question is not having that immediate feedback with using a feedback mannequin, which just seems to be so important and so crucial to that step in learning. This was an incredibly interesting study that I didn't expect to come across, but it's almost like looking at PSAs, and I've had my students do public service announcements before. So this was a media campaign that was conducted in a rural Danish community where they looked to increase comfort levels and also increase participation in CPR certification classes. So this media campaign ended up increasing participation in BLS classes. You can see that stat. I know it's a little small perhaps on your screen, but it increased the participation from 34% to 49%. So they also found that after this media campaign was conducted, that the willingness to use an AED on a stranger significantly increased, and MMV, you can see that stands for mouth-to-mouth ventilations, improved, and confidence in performing chest compressions and mouth-to-mouth improved. And that confidence level, that is the one thing that's really grabbing my attention. It's what I'm really gravitating to, because so many times I've heard people that I work with who say, I've taken this class, but I still don't even think I know what to do. Like, I still don't feel confident after walking out of there. And I know when I teach a class, I want that to change. Certainly recognize it's an emergent situation and that can create all kinds of anxiety, but what we can do, we can be really powerful in improving the outcome of that situation if we're confident and we perform the skills that we learn and that we know. What the study did find after the media campaign was that no significant changes were observed in the willingness to perform chest compressions or mouth-to-mouth ventilations, and confidence in recognizing cardiac arrest in the first place. So, but this was really promising and just a really different take on the topic that I really hadn't expected to find. Please see my references. Thank you for listening to my presentation. I appreciate any feedback either on the discussion board or otherwise. I decided to, since I did the voiceover and didn't do the video, I thought I'd just pop in a fun picture there at the end from Christmas of last year. So thanks again for your feedback. I hope everybody has a lovely Christmas, New Year, and holiday season. Take care.